If someone tells you that they have got hypo or hypoglycemia, what they mean is they've got a blood sugar which is less than 4 millimoles per liter or 70 milligrams per deciliter. You guessed it right. Today we are going to be talking about hypoglycemia. Hi everyone, this is Dr. Shabri Hussoor, physician and GP with special interest in diabetes from southwest of England, also the medical director of Adisha Health. Now let's come to the important part of hypoglycemia, that is treatment of hypoglycemia. If a patient is having blood sugars less than 3 millimoles per liter or severe hypoglycemia, the patient is having fits or reduced conscious level, do not waste any time. Please call 999. Please call the ambulance. Now, however, if the patient is having hypoglycemia symptoms and you do a blood sugar and their blood sugar is more than 4 millimoles per liter, but it's very close to that, then just give them a carbohydrate snack, like a slice of bread. You do a blood sugar for a patient with symptoms and you confirm that their blood sugar is less than 4 millimoles, they can swallow safely without choking, you can start the below treatment, which is giving them 15 to 20 grams of fast-acting carbohydrate, like 2 tubes of glucogel, which you can squeeze between the cheek and the gum so that it can absorb easily. Dextrose tablets, 4 of them, 4 or 5, depending on the manufacturers. 150 to 200 mils of pure fruit juice, or they can have 4 jelly babies. Once you do give this treatment, after 10 to 15 minutes, you repeat the blood sugar test. Now, if the blood sugars haven't come up more than 4 millimoles, you can repeat giving the fast-acting carbohydrates 3 times in total. For example, you've given it 3 times and then what happens? Either the blood sugar has come up or it has come down, or stayed down, it hasn't come up. If it has come up, then you can give the patient a long-acting carbohydrate, for example, 2 biscuits or a slice of bread or 200 to 300 mils of milk. Now, please remember, this is not the almond milk or soya milk, etc. This is the milk which is available over the counter. So you need to give that. If at all you've given the fast-acting carbohydrate 3 times the blood sugar still hasn't come up above 4, please call the ambulance because they will need a hospital admission and treatment in the hospital. So once anyone has got hypoglycemia, what you need to do is you need to measure their blood sugars even after it has increased. It has come up above 4 millimoles for 24 to 48 hours. And at least 3 to 4 times and sometimes up to 5 times to optimize the insulin dose. If someone is due for an insulin dose, do not omit it. You need to just optimize the insulin dose depending on the care plan for you or after discussing with the healthcare professionals. Now, I'm going to tell you a particular treatment which is done in severe hypoglycemia. It is not done in all cases. Your healthcare professionals would have very carefully chosen which patients can have this injection. Now, if the doctors or the nurses, specialist diabetes nurses has taught your caregivers or your family, then only please attempt this. That is, if the patient is having severe hypoglycemia, you have called the ambulance, you can inject a particular medication called glucagon into the muscle if you're trained while waiting for the ambulance. So coming to the take-home message, be aware of the hypoglycemia symptoms. If you suspect, measure a blood sugar. If you confirm, then start the treatment. If someone is having a severe hypoglycemia, call 999 or call the ambulance. And if your family members are trained to administer glucagon intramuscular injection, do so. If the patient is awake with it, able to swallow without choking, start the oral treatment without any delay. Optimize your insulin doses after discussing with your healthcare professionals. Wear a bracelet, or a pendant which says that you are diabetes patient or you're on insulin, because if the hypoglycemia happens in a place where no one knows you, or your family or friends are not there, then if you have this bracelet, someone else can help you more efficiently, more time efficiently, and more promptly. Thank you for listening. Please like, share, and subscribe. Hypoglycemia, one, it is preventable. Two, if it is picked up early, it can be treated really well. Hypoglycemia can be life-threatening. However, if you treat promptly, it can be life-saving. Thank you, everyone.